You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Annie Fitzgerald, BHC Director of Member Engagement and Health Solutions.
Hello, I'm Annie Fitzgerald, and welcome back to the BHC's Be Health Connected podcast. In the United States, chronic diseases take a heavy toll on individuals and businesses. The statistics are staggering. 6 in 10 adults have a chronic disease, and 4 in 10 adults have 2 or more. Conditions such as heart disease, cancer, and diabetes are the leading causes of death and disability in the U.S. They also account for a whopping 90% of the nation's $4.1 trillion in annual healthcare expenditures, which poses an enormous economic burden on both employers and employees. But what if we could address these conditions through preventative measures, early intervention, and lifestyle changes? Today, we are thrilled to be joined by Dr. David Houghton, the Medical Director of Digital Medicine with Ochsner Connected Health, to share insights on how digital solutions can help employers provide personalized support and make well-being a strategic focus for their organization. Dr. Houghton, thank you so much for being here.
Andy, thank you for having me.
Well, we're so excited for you to join us today. To get us started, I'd love to get your thoughts on, what some of the most prevalent chronic conditions in the U.S. are and how they're currently impacting the workplaces that you're familiar with.
Well, thanks for that question. And I think it really does present the burning platform for all of us as Americans, as employers, and as physicians to really try to tackle this pandemic of chronic disease. You had mentioned the burden of cost. Nearly 90% of the over $4 trillion expenditures goes to taking care of chronic diseases. And most of those chronic diseases in the top 10 are related to heart disease and its surrounding organ impact. So hypertension is number 1, high cholesterol is number 2. In the top 5 is also diabetes. And then existing heart disease for someone who's had a heart attack. It's only arthritis that cracks that top 5 that's not somehow linked to cardiovascular health. And you mentioned that I'm the medical director of the digital arm of Connected Health here at Ochsner, but I'm also a neurologist. And so my ordinary day job, where I spend about half of my life, is taking care of patients, and many of them have had the unfortunate consequences of these chronic diseases, like strokes, that I see every day when I'm walking through the hospital. So the impact on individuals is staggering. The impact on the workplace is similarly staggering. We know that if you have a chronic condition, you're 3 times more likely to have heart disease and 4 times more likely to have that stroke. If you have a stroke, only half of those patients, 50% of them, are able to ever return to work. And the costs for an employer can really add up, particularly recognizing that even if someone hasn't had a stroke or a heart attack, but they're just having poorly managed diabetes, for instance, they miss between 5 and 6 days of work per year just for that condition alone. And so for those of us that spend 40 hours or more with our employer per week, it's not surprising how much this impacts us, not just at home, but also at the job.
You're totally right. And it really sounds like, these chronic conditions have such an impact on things like absenteeism, presenteeism, that employers are seeing on a daily basis, especially now post-COVID, when employees might have delayed care. Are there any other challenges that employers might face when managing employees with chronic conditions?
I think the biggest challenge is perhaps the stigma. People look at chronic diseases, particularly the relationship of obesity behind many of those chronic diseases. In fact, those top 5 that I mentioned, hypertension, diabetes, even arthritis, all of those are impacted by weight. I think there's a stigma around it that folks want to keep their chronic ailments to themselves, and they don't want to necessarily feel like they're in an environment at work where it's shareable. But what I tell our employers is, in fact, there's no better place for an employee to at least be able to embrace their healthcare journey. And if we could remove some of the stigma, recognizing that healthy eating choices need to be available in the workplace and challenges for physical activity need to be available in the workplace. If we reduce that stigma and we allow an individual to really be able to work again where they spend often 8 to 5 and even more every day on themselves. I think that's completely appropriate. The second thing that is difficult for employers to deal with is the fragmentation of healthcare. Now, in fact, it's absolutely expected that in an organization, employees will have different primary care doctors and different endocrinologists, cardiologists, orthopedists. But when you're thinking about new solutions, what can we put forward that really levels that fragmentation of the playing field and offer products from an employer that's going to allow some of those chronic diseases to be managed simply, and in our circumstance with what we've done at Ochsner Health, digitally, so that it really reaches the patients where they are, not just physically, but where they are in their healthcare journey.
Yeah, the stigma, I think, is a really large piece that you mentioned with, not only employees feeling that stigma, but maybe employers or the managers within employers being, nervous to approach employees with chronic conditions and really understand how to better support them because of that stigma and not wanting to make an individual feel uncomfortable. So I think, a big part of it is just creating that culture of health and, creating, an environment in which employees feel supported, and not only the employees, but also, their supervisors, their managers feel supported and empowered to actually help those employees. So, I really appreciate you touching on that stigma piece. You mentioned digital strategies. Can you tell me a little bit more about, what kind of supportive digital strategies employers could utilize in the workplace and how they might help employees better manage their conditions?
Absolutely. So the growth of remote patient management as one piece of the healthcare jigsaw puzzle, I think, is really fascinating. And so recognizing that on the smartphones that we own, the other smart devices like tablets and laptops that are in our home, even ambient devices like watches or pedometers that somebody can wear, there are unique ways that we can transmit data from our own being, from our lifestyle, that really holds a lot of power for a patient to be self-efficacious and really know that they've begun to have the capacity to reach their own goals. And so those types of digital strategies are upon us. There's lots of third-party companies out there that have weight loss strategies, diabetes and pre-diabetes programs to look at musculoskeletal pain, mental health strategies that became uniquely necessary during the COVID pandemic, and recognizing that many folks need some unique help there. And I think in a world where all of us no longer just bank, but we online bank, and many of us no longer just go to the grocery store, but we have our groceries delivered, or we shop on Amazon, it's not unreasonable to expect that the power of that consumerism ought to be part of the way that we help take care of ourselves from a medical perspective. And when you start to recognize patients, recognize people as consumers of their own healthcare, that have more than anyone else, more than the employer, more than the government in addressing some of these costs themselves, to really be able to help, that in fact they will be the ones that help drive their wellness more than anybody.
And I imagine when that kind of consumerism comes into play, that's where, these digital solutions, as you said, can have an impact on the fragmentation of care. Can you speak to that a little bit, and how, maybe a solution like Ochsner is helping to, prevent that fragmented care, and how, maybe other solutions in different spaces might be working towards that and really connecting care? I think for, some of the employers that we're working with, one of their biggest concerns is, making sure that if an employee is using some kind of digital strategy, they still have some kind of relationship with a primary care provider or somebody who's kind of, connecting their care. So would love to hear your thoughts on how solutions can really support, making sure employees are receiving the most connected care they can.
Yeah, thanks for that. Ochsner Connected Health is now at almost the end of a 10-year journey of appreciating where the traditional healthcare experience really can't keep up with our own expectations for access and ease of communication and high levels of service and transparency and ease of use. And so when we built Ochsner Digital Medicine as part of that connected health journey, now again, almost 10 years ago, out of Innovation Ochsner, our research and development suite that we hold here in our institution with some of my colleagues like Dr. Rich Milani and Amy Quirk. The goal from the beginning was, as you suggested, Annie, to decrease fragmentation and create a product where we could simplify and make personal the interactions that somebody would have to manage something as specific as high blood pressure or as specific as diabetes. And by putting together programs that utilize health coaches, that utilize clinical pharmacists, APPs like physician assistants and MDs to be available to make medication changes, and to do that not just reactively based on what someone is showing on a blood pressure cuff or on a glucometer to measure blood glucose, but proactively in a predictive model. That really is where the power is. And to take patients who historically have been perceived to be more difficult to control or have complicated medical histories that really require a different model. This has been the promise, and fortunately, that promise has been kept for now more than 30,000 people who have been part of this program over the last several years. And so whether it's Ochsner Digital Medicine with these solutions or others, it's important that we layer this on. We don't interrupt the existing primary care relationships that are so dear and the specialty relationships that are so dear, but function as a high level complementary service or augmentation to those programs. One of the analogies I give is myself as a neurologist. As I mentioned earlier, I have patients who come to see me to manage their Parkinson's disease or their Alzheimer's disease. And I communicate what I do for those patients back to their primary care physicians. It's important that when we have a program like ours, that we create an environment where patients feel comfortable working with a team that really does everything it can to function in addition to and with respect for the primary care relationships that already exist.
Well, like I said, I think that's exactly what employers are currently looking for. They really want employees to feel connected and feel like they, like you said, have a team surrounding them to support them in their healthcare journey. In addition to this idea of fragmented care, I imagine there are some other barriers to implementing digital solutions in the workplace. Can you talk a little bit about how some of those additional barriers can be overcome?
Yeah, that's a good question. So we talked a little bit about the stigma. We talked a little bit about the fragmentation. A third one I want to talk about is just the practicality and ease of use. Many of us as digital health consumers can be overrun with all the different options out there. Several years ago, my family cut the cord, as many people have done for getting cable television in the home. And I thought for certain this was going to make things so much simpler. And now I've got probably close to a dozen different streaming services that I've layered on top. I think I'm still saving a few bucks, but I probably need to reassess that as well. But I think patients can similarly be overwhelmed. And we mentioned fragmentation in a large employed population that sees different doctors in different environments. You can similarly see fragmentation of digital options. And so I think, employers should vet and think critically about the relationships that they build and try to assist a patient to find that really personalized model that's going to be best for them. And that can be done through benefits packages, that can be done through open forums. But if we only swap the fragmentation of the traditional healthcare journey with then a fragmentation of the digital healthcare journey, we probably haven't helped anyone as much as we'd like to. And so really staying hyper focused on what the patients as employees need, I think is critical. I think the other thing that can help overcome those barriers is if we think about health in the workplace from a top-down perspective, that from the leaders as just as important with any other change management initiative. If I look to my right in my office, I have a bookshelf full of books that have been written by health care professionals, but also business professionals, all of whom are smarter than I am about change management principles. But I think many of those books don't touch on what we can do from a change management perspective with the individuals who work for us related to their health. And so I think we're on the cusp of really considering those types of models as well. So avoid not just fragmentation outside of the workplace with healthcare, but similarly with the digital products, and help patients on that journey the same way that you would lead from any other perspective in your organization.
Well, first of all, I love the analogy of, cutting the cable cord to the, numerous kind of digital point solutions that are available to employers now. I think that's a perfect analogy. But I think, what you were mentioning about, ensuring that employees kind of have this personalized support, a large portion of that can also be in an employer's communication strategy. So really trying to understand as an employer or as a benefits team within an employer, what are all of the solutions? What are all of the programs and partners that we have or who we're partnering with? And how can we best communicate that to employees and really ensure that employees understand what programs might really work well for them? Would you agree with that kind of communications arm as being a really, strong part of a comprehensive benefit strategy?
Annie, that's an excellent point, and I 100% agree. In fact, as we have now partnered with employers with strategies available in all 50 states and in DC, we know that there is not one size fits all for an employer or the employee. So it's been really important as we come in and have a chance to have a seat at the table and talk about where Ochsner Connected Health initiatives may be something that they want to offer, that we help them work through what that communication strategy is going to be. And your point about trying to align those goals, I think, is really important as well. The same way that you want to create that environment where an individual employee, somebody who's struggling with a health condition, can align their own goals with a digital app and a digital team. I think the employer needs to work diligently about what their goals are. What are some key indicators of what they're looking for, whether it be reduction in the number of work days missed, or whether it be, as you suggested in your opening remarks, something related to decreasing the cost of care. So that communication piece is going to weave itself through all those messages.
Certainly, definitely. And I think, even beyond some of the more hard metrics that are out there, I think more and more employers are thinking of things like VOI, so value on investment, and really trying to, just put their best foot forward and make sure employees understand that they're supported. And so showing some of those qualitative improvements in, quality of life or, employee engagement and morale, those can have, huge impacts as well in this kind of digital solution space for employers. When we think about the world of digital solutions and this really, as you mentioned, consumer focused approach to benefit solutions, are there any new developments or research in the field that you find particularly promising?
That's a great question. I'll answer it in two ways, and one is sort of on the horizontal and one's on the vertical. So horizontally, if you're thinking of the expanse of what connected health looks like, I think we are, and many of us in the field are looking at ways that we can find a solution at many steps along an individual's journey with their own health. And so part of that is in the remote patient management wing of using different devices, and I'll talk about a couple of those in a minute that are coming forward. But a lot of them still are ways that we can support folks with episodic care points, things like e-visits, where an individual is able to two-way text or communicate asynchronously with healthcare providers based about a specific ask or a specific ailment, or e-consults, where two healthcare providers are able to work closely together and really do it in an organized and valuable fashion. Ways that in medicine we sometimes talk about the curbside consult, where let me phone a friend and see how they might think about this differently. We we can actually codify that and make that part of an expectation for patients to be able to have their physician or other healthcare provider get a second opinion or a third opinion from another consultant to really add a breadth and depth to the work that they do. And of course, virtual visits, and not asynchronously, but synchronous visits, were growing in utilization prior to the pandemic and then exploded during COVID. And so ways that we are not looking back from that, but looking forward and adding in more diagnostic tools. So I really think of that as sort of a flattening of it on the horizontal. Vertically, going deeper now into ways that we may take care of a condition, I think is super interesting too, and lots of dollars and effort and brain power is being poured into this across the globe. Things that we can improve ambient monitoring, the simplest of which would be a pedometer that you don't need to think about, but other ways that you can measure somebody's oxygen utilization in their own home, or ways that you can help track somebody's blood pressure simply by looking into a phone or wearing a device, as opposed to something where episodically you would need to put on a blood pressure cuff. That technology is somewhat out there. It's getting better and better. And I think there's other ways then that we might be able to apply AI and machine learning based on that. So putting together models for an individual patient on where they are stopping in and coming out on that horizontal healthcare journey, but also how deep they are utilizing some of the devices out there and the data gathering out there. If you mash all that together, you really are able to create a benefit profile and a risk profile for how somebody is going to do, hopefully positively, with getting their hypertension, their diabetes, their hyperlipidemia, all of their chronic diseases under control, and then ultimately have us cut way down on that 90% spent of now over $4 trillion bill to this country. And so I think we really are, as cliche as it may sound, at the tip of the iceberg for where the field of digital medicine is going.
Definitely. And I think, for many of our employers, that they likely maybe have had digital solutions, on their benefit plans for years. But now, post-COVID, are really taking a critical look at the solutions they're currently offering, taking a look at the solutions that are available to them and that they might want to expand or maybe, replace a previous solution. Any parting words or, words of encouragement or words of advice for an employer audience when trying to navigate something like the digital medicine landscape?
I think, based on everything we've talked about today, Annie, my elevator pitch really drives home the point of reducing fragmentation and increasing simplicity. And while there are those pitfalls of fragmentation in the digital world, that if you really look closely at the opportunities that already are in existence, and think of your patients as part of the family that you really want to keep well, and you really want to try to meet them where they are on that healthcare journey, there's no better time than now to think differently about it. And employers historically, because of the way that our healthcare system is set up through means of private healthcare insurance, they have always been at the forefront of either action, but certainly opportunity to make people healthier. And I think, if anything, this is the call to action to do that, and it has true benefits on the wellness of your population and true financial benefits as well. I would also suggest that for the folks in the audience, every one of us, whether we work in healthcare or we're a large employer, we're also patients ourselves, and to challenge all of us to really think about this idea of self-efficacy and trying to be the one who, more than anyone else, can take on the responsibility to go to that next level for our own health, and to in some respects put pressure on employers to help us change and to help us take care of ourselves. And when we do it together, a healthcare institution, an employer, a insurer, and certainly patients themselves, then everybody benefits. And I think this is really the time to do that more than ever before.
Well, we'll certainly take that call to action to our employers and really appreciate your time today, Dr. Houghton, and look forward to hearing reactions from our employer members in the community. Any last words?
I certainly appreciate the time that you've given me today to talk about something that I hope you can tell I'm quite passionate about. And I really do appreciate the good work that BHC does. And so thank you for the time.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.